Hello, everybody. Yes, I was hoping 12 o'clock meant 12 o'clock for the governor's press conference, but obviously a little bit behind. The press release said 12 o'clock start. Sometimes these start right at 12 o'clock, and sometimes they come afterwards. So there should be some music in the background. When I start to stream and it's nothing but quiet, people always say there's no audio, no audio, no audio. So that's why I put the music on there, so you know that your audio is working, that my audio is working. So that's the reason why we put audio there. So, but hopefully this gets started here quickly, as some action items are expected. What those are, I'm not sure, but I do believe this is going to be. You know, there's a lot of press conferences that the governor has with a lot of health officials, and they kind of get talking about various things. But today, only the governor and the commissioner of health, Lance FRYE, are the only two people expected to talk today. So I really think we're going to see some action items. What those are, I have no idea. But I can tell you for Logan County. I looked at the numbers today. They come out at 11 o'clock every day, and I got them on the bottom of the I've got so many notes written down. I'm not sure what I did with. Oh, it's right here underneath. Got to flip it around. But for Logan County, there has now been a total confirmed number of 1,122 total cases dating back since March. 924 have recovered. 3 people unfortunately have died with the COVID virus. But right now, 195 active cases in Logan County, and that number really has skyrocketed over the last 5 or 6 days. There for a while, we were averaging about 130 active cases per day. Again, this is for Logan County. But now it's at 195 active cases, which I look at the numbers every day. There's some days I do miss out on some of them, but 195 active is the most I've seen at one time. So, and that's for Logan County. Again, Logan County, 48,000 people estimated. We'll know here in several months to a year when the census all comes out, but Logan County estimated to have 48,000 people. Again, a little over 1,100 confirmed cases in Logan County. Again, those numbers have gone up a lot. I did a story just last week on Guthrie News page. I can't remember if it was like a Wednesday or Thursday that we had just gone over 1,000 cases. So we've had over 120, 130, somewhere in the estimated range in the last 4 or 5 days in Logan County alone. So anyway, so that's the update. It looks like I just got a breaking news deal. I saw it over the weekend, but it looks like Oklahoma City Thunder are getting ready to trade away Chris Paul. CP3 getting ready to leave the Oklahoma City Thunder as expected. We didn't know what team that would be, and it looks like that team will be the Phoenix Suns. I'm not sure what the Thunder will get in exchange, but the Thunder getting rid of Chris Paul, who I think is going to make like $85 million over the next 2 years. So Chris Paul, again, leaving Oklahoma City. Of course, he was here with New Orleans Hornets for a couple of years because of the hurricane. But yeah, Chris Paul to Phoenix. Of course, Dennis Schroeder, the great player off the bench for the Thunder. Sounds like he's going to go to the Los Angeles Lakers. I think that'll be finalized after the draft. And so the camera's moving. I think we're getting ready to go to the governor.
Welcome, Bond. Thank you so much for joining us today. I'm here with Commissioner of Health, Dr. Lance FRYE, and Jim Hopper, who's the president of the Oklahoma Restaurant Association. Thank you so much for being here today. As you are aware, our cases of COVID-19 continue to go up here in Oklahoma, and they're continuing to go up all across the country. The number of people hospitalized with COVID-19 in the state of Oklahoma has gone up 19% just in the last week. Throughout this entire battle, my first priority has been to protect the health and lives of Oklahomans. That's still true today, and it's always going to be true. Two other things are also very important to me. We're going to keep our businesses open safely, and we want to get all kids back in school at the end of the Christmas break. In-person learning is so important to the development and the mental health of our children. Those are the goals, and it's going to take everyone's help in the state of Oklahoma to help us get there. Today, I'm announcing the following actions. Effective Thursday, restaurants must ensure that all tables are 6 feet apart. This will allow them to continue to operate safely while making sure everyone is socially distanced. If they can't stay 6 feet apart, they can also install properly sanitized dividers between tables, booth, and bar areas. The goal is to keep groups separated so we can slow the spread of COVID. Also effective Thursday, I'm requiring all bars and restaurants to close at 11 p.m. No in-person service of food or alcohol will be allowed after 11, except for curbside or drive-through windows. We need to slow the spread of this virus. Data shows that social distancing is harder to maintain as it gets later at night, especially in bars. Starting tomorrow, I'm requiring all state employees to wear a mask in common areas or when they're around people at work. This applies to 33,000 state employees across all state agencies that fall underneath the executive branch. Masks will be required for anyone visiting state buildings as well. I continue to encourage Oklahomans to wear a mask, wash your hands, watch your distance. I've been saying these for months. They work, and we need your help. From the beginning, I've promised Oklahomans to always make the right decisions based on the facts and the data here that we're seeing in Oklahoma. We've been fully reopened for 6 months now, but recently we've seen our numbers starting to climb. We were really flat, really plateaued for about 5 months. We're starting to see them come up. Based on the data in our state, specifically the rise in hospitalizations, now is the time to do more. We need to pull together. Oklahoma, I need your help. But more importantly, our doctors, our nurses, our healthcare professionals, and hospitals need your help. Today is the 113th birthday of Oklahoma. Oklahomans have rallied together during tough times and throughout our history, and we'll do it one more time together. What we're announcing today, it won't last forever, but they're targeted steps that we can do to keep Oklahomans healthy, to keep our businesses open safely, and to keep our kids back in school in person. The reality is these steps, they're not magic bullets. It's up to all of us. This virus is spreading throughout the country right now. Oklahoma's not alone. Big cities, small towns, West Coast, East Coast, all in between are seeing their cases increase. Each one of us has a role to play in this fight. I need every Oklahoman to think about what they personally can do to help slow the spread. Wear a mask when you're around other people, watch your distance, and wash your hands frequently. With that, I'll turn it over to Jim Hopper, who's the president of the Oklahoma Restaurant Association. Jim?
Thank you, Governor. It's a pleasure to be here with you today. My name is Jim Hopper, as the Governor said, and I'm the President and CEO of the Oklahoma Restaurant Association. On behalf of our membership across the state of Oklahoma, I want to let Oklahomans know that our industry supports the actions that are announced today by the governor. The governor and Commissioner FRYE have asked all Oklahomans to do their part to slow the spread of the virus. We're committed to doing our part as an industry while continuing to operate our businesses safely. The governor has set the example by requiring masks for his state employees. We will follow that example and ask and request that all restaurant workers wear masks during their shifts as well, and those times when they're not on their shifts. The Oklahoma Restaurant Association joins Governor Stitt, Dr. FRYE, and our medical community in asking Oklahomans to wear a mask, watch their distance, and wash their hands frequently. Please continue to think about how you can support your local restaurants. We desperately need your help, whether it's dining in safely or ordering food to go. Thank you, Governor, and I'm going to now turn it over to Dr. FRYE.
First, I'd like to thank the governor for taking additional actions today to slow the spread of COVID-19 in Oklahoma. We know this virus is everywhere. If you think it isn't in your community, you're wrong. It's living among us all around the country, and we have to take it seriously. Here's a map from Johns Hopkins showing the latest across the country, and as you can see, Oklahoma is certainly not alone. By now, every Oklahoman has heard us talk about the 3 W's. Wear a mask, wash your hands, watch your distance. These actions aren't trite. Science says they work to slow the spread. The governor has said countless times to wear a mask, and it's critical that you do. Masks work, but we can't just anchor on masks. They're only a part of the story. Like all Oklahomans, I am looking forward to Thanksgiving next week. I love Thanksgiving. I love getting together with my family. We have family traditions, as I'm sure you do as well. And I want everyone to take the time to enjoy their time off with their families, take the time to recharge. But we have to do it safely. If we don't adjust how we gather safely next week, Christmas could be much worse. It's been a long, tough year full of challenges and disappointments. COVID has changed all of our lives. That doesn't mean you can't enjoy the holiday. Small things can make a big difference. Get a free test before gathering with your family. Call 211 to find out where you can go to do this. Spread out tables around your house so you can distance appropriately. Open a window or a door. Eat outside if the weather's nice. Wear a festive mask for the holiday. Deliver food to at-risk family members and talk to them from a safe distance. One of the reasons I love living in Oklahoma is because we care about each other. It's what makes our state unique. Today, the governor and I are taking continued steps to slow the spread, but we can't do it alone. We need your help to do the right thing. The health and life of every single Oklahoman is worth it. Join with us. Let's make this Thanksgiving a safe and happy one. Governor.
Thank you, Dr. FRYE. Thanks, Jim. Really appreciate you being here. Remember, Oklahoma, we have 3 goals. Number 1, protect the health and lives of Oklahomans. Number 2 is to keep our businesses open safely. And number 3 is to get all kids back in school, in-person learning at the end of the Christmas break. The CDC has found that not being in school is significantly impacting the mental health of our young people. As a father, that breaks my heart. We need to slow the spread so we can get our kids back in school. With those goals in mind, we're taking these steps, requiring restaurants to space their tables 6 feet apart, closing bars and restaurants at 11 p.m., and I'm requiring each of my 33,000 employees to wear a mask while they're at work. These aren't our first actions. They won't be our last. I've issued dozens and dozens of executive orders since mid-March. We've acquired PPE, we've suspended regulations, and we've built up capacity in our hospitals. We are continuing to work with the hospitals and our medical community every single day. We're working on more ways to get rid of red tape to make sure hospitals can take care of everyone who gets sick, COVID and non-COVID patients. We'll keep following the data and do what's best for Oklahomans. We'll make the right decisions at the right time. A vaccine is on its way, but we need to buckle down until then. I know we're all getting tired, but this is really important. I need your help right now to flatten this curve. We're all going to have to make sacrifices in one way or another, but they're sacrifices worth making to keep everyone healthy, keep our businesses open safely, and to keep our kids back in school in person. We'll open it up now to a few questions.
Requirement that state employees wear masks. Does that apply to this building and lawmakers?
We're reaching out to the pro tem and the speaker, and I'm assuming they're going to follow suit with the building that they control.
Governor, with the back to school initiative, do you have anything specific as to what you're aiming for or requiring? I mean, obviously every district is unique and different. How would you go about enforcing back to school after Christmas break?
Well, that's, we believe in local control, and unfortunately, I cannot mandate every single school be back in person. About 93% of the districts across the state are in-person school right now in some format, whether it's AB or it's fully in person. But there's some schools, Tulsa Public Schools, for example, has not been back in school this entire year since last March. It breaks my heart what's happening to those kids in the Tulsa Public School area. So we're laying down the goal right now, and I need Oklahomans, I need parents, I need teachers, I need them to move forward. We have to be safe. We've got to flatten this curve so we can get our kids back in person after the Christmas break.
Just to follow up, are you talking about sanctioning, or finding, or penalizing a district who doesn't go back until maybe March?
Yeah. So again, I can't demand a school, the way our system works, we have local control in place. We have locally elected school boards and superintendents that have to make that call. The parents that I've talked to, in some cases 90% plus, are voting to be in person. So I'm laying out the goal and the vision. I believe that every kid needs to be in school in person after the holidays. That's my goal, that's the vision, and I'm going to be pressing and I'm going to be pushing and I'm going to be asking Oklahomans to help me with their local districts to require their kids be back in school.
When you said your requirement that visitors to state buildings have to wear masks, that doesn't apply at this moment to anywhere in the Capitol? So
in the Capitol, I'm going to need to verify that with the speaker and the pro tem. So the Capitol is a little different than the other executive state buildings. The speaker and the pro tem, I'm assuming they're going to. I just haven't personally talked to them. I know my chief of staff spoke to their chiefs of staff. I'm assuming that they're going to have the same requirements in this building. But this is not considered a state building that I have direct authority over. This is the legislature's control over this building, and so that's going to be something that will have to be talked through with the speaker and the pro tem. I'm 99% sure they're going to be with us on it, but I just can't speak for them.
Governor, I think most Oklahomans feel like the step towards restaurants are fairly minimal. I mean, Oklahoma City and Tulsa, a lot of restaurants are already counting the distance of their table. Most people don't eat out after 11 p.m. I mean, do you really feel like this will have a significant impact on fighting the virus?
We think these are great steps. I mean, when we met with our analytics team, we actually brought in Google to determine what are the steps that we can do to lower and flatten the curve. And the two suggestions they made were bars after 11 p.m. and make sure that the restaurants were social distance. And so that's why we came out with that today.
Is there going to be a deadline for this, and how will it be enforced?
I'm sorry?
Is there a deadline when it'll end, and how will it be enforced?
Jim, do you want to take that? We don't have a deadline right now. All of our executive orders have to be re-upped every 30 days. And so throughout this whole pandemic, we have re-looked at every executive order that we've issued, and we'll renew those every 30 days. If we're seeing them work and we're seeing the cases go up, the goal is to flatten them down, continue to protect the health and lives of Oklahomans, but also keep our businesses open safely. We talked to the Restaurant Association. We think that these are reasonable steps that we can make. I am not worried about the compliance because Oklahomans are compliant, and the restaurants are doing a great job. If you remember back in March when we limited any in-dining restaurants and then everybody innovated and went to curbside, we don't see any problems after 11 p.m.
So there won't be an enforcement policy, or you're just operating on our system, or is there going to be a way?
Well, the state obviously has the ability to pull licenses from different businesses. We haven't discussed that because, again, we're just rolling this out right now. I anticipate everybody being in compliance. We're all Oklahomans. We're all trying to flatten the curve together, and not even thinking about the enforcement at this point.
Is there any discussion of cutting capacity of bars and restaurants rather than just the social distance aspect of it?
Yeah, we talked about the cutting capacity and putting a number on it, but every building is different sizes, and so we knew that 6 feet apart was the right thing to do. That's social distance, and so that's why we chose to go there.
Two questions on the vaccines. I'm curious, once a viable vaccine candidate is distributed to the states, I'm curious, do you plan to get the vaccine, and will you recommend that others get it? And then also, are you talking about any sort of recommendation for school children to get vaccinated, just like they would for, pertussis or diphtheria or anything like that?
Well, number one, we've got a great plan on vaccinations, and we're going to prioritize our healthcare workers, our long-term care facilities first. We think that our first batch will be 2,000 samples. First responders, healthcare workers, obviously first. I'm not going to stand in line ahead of anybody else. I already have the antibodies, and so I'm recommending that everybody gets it once it's available, and follow, obviously, just like we always do, follow your doctor's recommendations. Yeah, so this isn't about magic words. This is about doing the right thing. We're encouraging all of our municipalities, if they're seeing cases rise in their state. I'm also going to implement a call every single day with statewide elected officials, giving them hotspots, some data that we can share with our health professionals on how they can slow the spreads in their community. But again, we've said wear a mask since March. 100 times. We've said it today 100 times. Really, it's not about magic words. It's about making sure that Oklahomans are taking this seriously. I believe that we've taken our foot off the gas a little bit. For 5 months, we've been fully reopened for 6 months. So for the last 5 months, we were really flat on our curve. We were having about 1,000 a day cases, and hospitalizations were bouncing between 500 and 600. And over the last month, we've really seen it come up. So now is the right time that we have to take it more seriously. We've got to institute some of these things that we're doing today, and I'm asking Oklahomans to do what we did back in March and April and May, and continue to innovate, continue to help me flatten the curve, help our healthcare workers flatten the curve. The thing that we cannot let happen is our hospital capacities continue to rise and increase. We have 1,280 folks in the hospital being treated for COVID today. We want to watch that very, very closely.
Several hospitals are at capacity, Stillwater and Cypress. What kind of plans are in action now to help the hospital capacity situation?
Yeah, Dr. FRYE.
Yes. So, first of all, I just again want to reiterate that when we're talking about capacity, we're talking about staff capacity, so that changes very quickly. It can change by the hour as we have people that are admitted, discharged, staffing come on and come off duty, or they can flex up with flex nurses if they need to. So it is a very fluid thing. I'm not saying that we haven't had a strain on our system, because obviously we have. And there are periods of time where there are patients waiting for rooms, but there are periods of time outside of COVID where you have patients waiting for ICU capacity as well. That being said, we are working very closely with some chief medical officers and CEOs, hospital CEOs throughout the state, and monitoring this. So we put in a regional transfer system that they're doing right now. They're managing that themselves. We're using RMRS as the kind of the air traffic controller system to help them move those patients or see visibility on where beds are available to help them move those patients around. We're also working on selective surgical reductions. So we have some hospitals have already developed their plans and sent them to me. And we're going to continue to work with the Hospital Association to make sure that everyone is getting those plans developed and can start working that way as well.
Dr. FRYE, have you seen influenza start to impact hospital capacity as well as COVID, or has that not happened yet?
It's not really happened yet. I mean, we've had some hospitalizations from it, but it's been minimal. It hasn't really impacted it.
Mr. Do you have an update today? Since the last update was Friday night, do you have an update today on statewide hospitalizations and how many ICU beds are available statewide, or will we not have that?
It won't be until this evening. Those numbers don't come out until later in the day. Again, so we get them based off of EM resources, which is where they report to us at one particular time of the day. They have a certain time to get that in. So that's why it's so difficult, because you really need it changes constantly. So that's a snapshot of a point in time in a day. But we'll know that this afternoon.
What happened in the last 2 weeks to cause this explosion in cases? I mean, we had Halloween, we had the ice storm, we had early voting maybe. I mean, can you point to the contact tracing that shows this kind of huge buildup in the last couple of weeks?
Yeah, we can't really. I mean, we've been looking. We have a list that we put together of the clusters of cases, and the 10 highest ones are the snapshot that I look at every day. And there's really not been anything out there. I mean, it's not been an institutional increase anywhere like an outbreak. It's community spread. It's just increasing.
Commissioner, can I ask the same question? What harm would it do to institute a statewide mandate? There's no enforcement ability?
Well, I can't mandate that, so I don't have the authority to do so.
But you're a public health official.
Well, I can recommend it, I just can't mandate it. And we do recommend it, absolutely recommend it. We recommend everybody in the state to wear a mask. But that's the semantics on words. We recommend everyone to wear a mask.
Doctor, another question, because I think we're getting some mixed messaging from not just this room, but all over. If you have the antibodies, do you still recommend wearing a mask, and does that make you immune? Do we have proof that that makes you immune?
So that's a very difficult question to answer, because if you have the antibodies, the CDC says that for the first 3 months, you're basically immune. When we spoke with some other officials from the White House, they said that was a very conservative estimate from what they thought, but that's what they came up with. Now, there are multiple strains, so nobody really knows whether you're immune to all of them or not, but for at least 3 months, you're pretty good. I mean, I'm not going to make a recommendation whether someone wear a mask or not based off of that history. I think it's just easier for everybody to wear a mask.
So you said earlier that you support the measures and
I'm sorry, could you repeat that, please?
Yeah, you said earlier that you support your association supports the measures taken by the governor related to restaurants. Were there any measures that you discouraged the governor from taking, or that you opposed in your conversation with the governor's office?
No, not at all. We've been, as an industry, we started working with the governor and the health departments back in March. We had meetings with the governor and his team, and because they asked for some best practices for what our industry could do to help. And so we've been working very closely the entire time with the governor, and thankfully the governor and his team and the health departments, by working together, we've all agreed these are the best steps to take. And so we've done that. We've been doing that since last spring. And so we want to do our part now with the spike to help, and so we are very supportive of what the governor's asked us to do.
You feel like most restaurants are already kind of abiding by the 6-foot rule, and so what's the kind of impact?
I'm sorry, it's,
Sorry. Do you feel like restaurants are mostly abiding by the 6-foot rule, and so then what impact do you think?
well, yeah, you know what, there's always some businesses, not just restaurants, but some businesses that will say, you know what, it's, for whatever reason, these are not steps that we want to take. We have encouraged our industry and our members to do that statewide. We put out a daily update and have since March. And one of our biggest messages, you know, even where it's not mandated, it's a good thing just to model good behavior, to wear a mask, to keep not only your employees safe, but your customers safe, because our industry needs to survive.
What do you say to restaurants, and I've got a mother-in-law with a burger restaurants called Sheen, Better Bubble Sheen. What do you say to the restaurants who say, you take away a table, you take away some money, probably not going to get another round of PPPs for all that? There's obviously some fear. You close a table, you close off a little bit of income. What do you say to the business owners?
Okay. I really apologize, but it was difficult for me to get the gist of what you're asking.
He said, what do you say to business owners who are concerned about that they lose revenue?
Oh, that they're going to lose
You're taking
revenue?
away a table, you're taking away another check that comes in of food, you know?
Well, obviously restaurants need to survive. That's not true just for the restaurant, but that's true for the economy as a whole. Restaurants are one of the restaurant industry and the hospitality industry in Oklahoma is one of the largest private sector employers there are. So people need those jobs. Restaurants need to serve people. That's what they do. They do it well. And they need to generate the income, which generates a sales tax. So all those things, and I'm not sure I'm being exactly responsive to your question, but it's just so very, very important for this industry to survive. And so whatever we can do in cooperation and in partnership with the governor and with the health departments to survive, that's what we're going to do.
But are you confident that these new regulations will not be, you know, the straw that breaks the camel's back for some of these businesses?
It's going to be difficult, and it will take away sales, but we've seen so many restrictive things that have been done in other states by completely shutting down in-person dining, inside dining, and we don't want that to happen. And so whatever steps that we can take to allow the restaurant industry in Oklahoma to survive, that's what we'll support.
Governor, I have one other for you. Under what authority will these restrictions come? Will this be an executive order or under what authority?
Yes, it'll be an executive order.
Governor, quick question. Joe Biden is forming his coronavirus task force, but obviously Oklahomans are still kind of upset and questioning the outcome of the results. At some point, there is expected to be a call to the governors from Joe Biden's folks. Do you wait until the votes are certified, or are you going to start planning ahead in case he's president? Do you pick up the phone and chat at least, or how are you moving forward? You've got a Trump coronavirus task force, you've got a Biden coronavirus task force. Who do you talk to?
Well, I'm going to talk to whoever's president at the time. So now until January 20th, we'll talk to President Trump, and then we'll talk to President-elect Biden on January 20th.
Governor, have you had any discussions with the congressional delegations on around the stimulus? Also, the link-up period there that Congress will be back in. Do you have a wish list, so to say, go out to them and say, hey, guys, we need this kind of support here at home?
You know, we had I had a dinner with the federal delegation just a couple weeks back, and then we'll be in D.C. with them tomorrow and Wednesday. We're going out to meet with all the federal delegation again, and so that's one of the topics that we'll be discussing on what do they see coming down the pipe, and obviously with the changeover in administrations. We're not sure. They're still waiting on kind of counting some votes in the Senate in Georgia, and so everybody's kind of waiting to see kind of what that looks like and what type of proposal the Democrats or Republicans will put forward. But that'll be a topic of discussion tomorrow and Wednesday with them.
Thanks, everybody.